My background is as an osteopath, but also Chinese medicine and naturopathic medicine. I'm bringing into play all of those areas. So we might, for example, talk about nutrition. The body has incredible natural healing power. And very often what the practitioner is doing is helping the body heal itself. We may also decide that it's appropriate to use Chinese medicine, acupuncture for example. The patient very often is more receptive to that overall holistic approach as well. When a patient first arrives, we take a full medical history. We will then move on to doing a diagnosis that is medically based. So a lot of the information that a patient will provide would be very similar to that you might provide to your GP. You can tell a great deal from those things that are not actually described by the patient just by looking at them. I'm very conscious of value for money as part of the treatment process. I can get far more achieved within any given period of time, and the number of treatments that you might have could probably be reduced. So when you look at the economics behind it, we really should be looking at is the overall picture. If it takes 10 treatments from some other method to treat you and it only takes 6 for me to treat you, then the overall cost to you is restricted. So there's a financial benefit there as well. Osteopathic treatment can be robust, but equally it can be gentle too. And part of my ability, I suppose, is to get that person to relax and make sure that they understand that they're actually in control. I'm only going to be doing what we agree. And so when there are techniques where I will say, okay, now this is what we're going to do, explain exactly what they're going to do, and I say, right, now I want you to turn or lift or move your head, your arm, your back, and put pressure against me so that you are controlling the amount of effort you put in. And the gentle techniques are very often those that have the most effect. Again, if the patient knows that they have that control, that to me is the most important factor.